Have you ever found yourself nodding off at work after lunch or struggling to stay awake during a boring meeting? Most of us have, and usually we just say, "I'm tired." But here's the thing, what if it's not just tiredness? What if your brain is sending a signal that something deeper is going on? Today we're diving into a topic that's often misunderstood: narcolepsy versus normal tiredness and how to tell the difference. Before we continue, don't forget to like, subscribe, and share, because you might literally be saving a life. So many people out there live with this disorder, and it can be deeply frustrating and isolating. Your support helps this message reach those who need it most. By the end of this video, you'll know how to spot the signs, when to seek help, and how this neurological condition differs from everyday fatigue. Let's get started. Section 1. What is normal tiredness? Let's begin with something we all know: normal tiredness. It's part of being human. After a long day, intense workout, or a late-night Netflix binge, your body simply needs rest. That's your natural sleep-wake system doing its job. Here are the key traits of normal tiredness. It builds up gradually. You feel it coming: heavier eyes, yawning, sluggish thinking. It improves with rest. A good night's sleep usually resets your energy. It's situational. It's linked to specific things: stress, poor sleep, long work days. It doesn't disrupt your life. It might be annoying, but it doesn't stop you from functioning day to day. Example: if you stayed up until 2 a.m. watching a series and feel sleepy in class the next day, that's normal fatigue. Your body's saying, "Please let me catch up." But narcolepsy? That's a whole different story. Section 2. What exactly is narcolepsy? Narcolepsy is not just being tired. It's a chronic neurological disorder that affects the brain's ability to control sleep and wake cycles. Think of it like this. In most people, the brain knows when it's time to be awake and when it's time to sleep. But in narcolepsy, that control switch is faulty, and sleep can sneak in anytime, anywhere. Here's what makes narcolepsy different: sudden sleep attacks. People can fall asleep in seconds, even in the middle of conversations, meals, or driving. It's not about how much you sleep. Even with 8 hours at night, the brain still craves more sleep. It's lifelong. Narcolepsy is a medical condition, not a temporary phase. It's neurological. It often involves low levels of a brain chemical called hypocretin, which regulates wakefulness. There are two main types. Type 1, narcolepsy with cataplexy, sudden muscle weakness triggered by emotions. Type 2, narcolepsy without cataplexy, no sudden muscle collapse, but still excessive sleepiness. And here's the kicker: most people with narcolepsy don't realize they have it for years because they mistake it for just being tired. The key differences between narcolepsy and normal tiredness. Normal tiredness builds up gradually. It usually happens for a reason: not enough sleep, stress, or too much work. And the good news? A full night's rest or a relaxing weekend is often enough to fix it. You might yawn or feel sluggish, but you can stay awake if you really need to. Narcolepsy is very different. It's a neurological condition where the brain can't properly control sleep and wake cycles. Sleepiness comes on suddenly and is often impossible to resist, even during conversations, meals, or driving. It doesn't go away with rest, and people may also experience symptoms like cataplexy, sudden muscle weakness, sleep paralysis, and hallucinations. Key differences. Normal tiredness improves with sleep. Narcolepsy does not. Normal tiredness is predictable. Narcolepsy can strike anytime, anywhere. Normal tiredness is usually mild. Narcolepsy can disrupt daily life and even be dangerous. If your sleepiness is sudden, persistent, and affects your daily life, it's more than just being tired. It could be narcolepsy. Talk to a healthcare professional and get the right support. Normal tiredness. You yawn a lot during a long meeting, but you can fight it off and stay awake. Narcolepsy. You fall asleep mid-sentence and can't stop it from happening. Section 4, real-life scenarios. Which is which? Let's play a quick guess which game. I'll describe a situation. You guess if it's normal tiredness or narcolepsy. The first scenario: you stayed up until 3 a.m. and the next afternoon you're nodding off in class. That's normal tiredness. Your body is responding to sleep debt. The second scenario, you slept 8 hours, ate breakfast, and suddenly fall asleep during a conversation at noon. That's narcolepsy, because the sleepiness is sudden and unrelated to lack of rest. Third scenario, you laugh at a joke and suddenly your knees buckle and you feel weak. That's likely cataplexy, a classic symptom of type 1 narcolepsy. See how the difference lies not just in how sleepy you feel, but when, how, and why it happens. Section 5. Common symptoms of narcolepsy to watch for. If you suspect your tiredness might be more than just fatigue, here are some common warning signs of narcolepsy. 1. Excessive daytime sleepiness, constant urge to sleep even after a full night's rest. 2. Sudden sleep attacks, falling asleep abruptly, often without warning. 3. Cataplexy, sudden muscle weakness triggered by emotions like laughter or surprise. 4. Sleep paralysis, waking up but unable to move for a few seconds or minutes. 5. Hallucinations, vivid, dreamlike experiences when falling asleep or waking. 6. Disrupted nighttime sleep, waking up frequently at night. 7. Automatic behaviors, doing tasks while half asleep without remembering. If you check off several of these, especially the sudden sleep attacks or cataplexy, it's time to talk to a doctor. Section 6. How narcolepsy is diagnosed. Diagnosing narcolepsy isn't as simple as a blood test doctors typically use. Sleep studies, polysomnography measures brain waves, heart rate, and sleep cycles overnight. Multiple sleep latency test. MSLT measures how quickly you fall asleep during the day and how often you enter REM sleep. Hypocretin level tests, sometimes used to confirm diagnosis, especially in type 1. It's important not to self-diagnose. Many people go 7 to 10 years before getting a proper diagnosis because they think they're just bad sleepers. Section 7. Managing narcolepsy versus managing fatigue. If you're just dealing with normal tiredness, lifestyle tweaks often help. Maintain a consistent sleep schedule. Stay active during the day. Manage stress. Watch caffeine and screen time before bed. But with narcolepsy, these alone aren't enough. Management often includes medications, such as stimulants to promote wakefulness or drugs that improve REM regulation. Scheduled naps, short naps during the day can help reduce sleep attacks. Behavioral strategies, creating safe routines and planning around symptoms. Support groups, connecting with others who understand the condition. Narcolepsy is lifelong, but with proper care, most people can lead full, active lives. Here's the bottom line. Not all tiredness is created equal. If your fatigue goes away with rest, it's probably normal. But if it's sudden, persistent, and disruptive, it could be narcolepsy. This condition is more common than you think, but it's also widely misunderstood. Recognizing the signs early can lead to faster diagnosis, better treatment, and a much better quality of life. If you found this video helpful, hit that like button, subscribe, and turn on the notification bell because we have more videos on narcolepsy coming soon that you won't want to miss. And remember, listening to your body isn't just self-care, it's life-saving.